Anthony DeFranco. He is the president of the Open Insulin Foundation, which is developing open source technology and knowledge bases for local scale production of insulin and other essential biologic medicines. He's researched numerical computation, purely declarative probabilistic relation programming languages in the PhD program at UC Davis, and did freelance research in the fields of programming language theory and theory of computation. Anthony holds a BS in physics and a BS in computer science and mathematics from Yale University, where he studied control theory, statistics, and information theory and neural networks. And with that, I will give it over to Anthony.
Thank you very much. I didn't know you were going to read that out loud. I would have made it shorter. All right, yeah, and thank you for having me here. I am going to try to address in a very broad way a number of themes and complaints that have come up in many people's work and presentations, and it's a lot in a little bit of time. So I have bonus slides at the end and everything. So I encourage you to scan that QR code so that you can enjoy at your leisure afterwards. Oops, here. 5 more seconds. All right. Okay, so I am going to try to cover the very broad history of the kinds of institutions that shape the conventions and constraints of business and regulation and the other factors that influence our work, and look at some of the flaws in that, some of the consequences, and how open source addresses those concerns. And it's going to start by looking at Open Insulin's work, but I'm going to try to get to the bigger picture themes that are coming up and bring them out explicitly when often they're in the background. And then, in some of what is in the talk and some of the bonus slides are in the form of a bibliography with comments more than me actually telling you what the point is. So it's, an exercise for the audience. So we are in many different relationships with the kind of incumbent research to business pipeline. Some people are engaging with parts of this. Some people are trying to avoid all of it, like me. Some people are going in and out, weaving and bobbing and so forth. But, it kind of starts with academic research where there's a combination of personal sacrifices and expenses you bear to get your credentials, and then you go and you apply and compete for your grants, and to go through all this process of getting credentialed and becoming a PI and getting grants that could take decades, and it takes hundreds of thousands to millions of dollars to do it, and then to get the grant money, and you're spending your grant money, and that's kind of the order of magnitude of what goes on the balance sheet that eventually needs to be recouped. And then you go and you want to take some of your technology to market, so it's going to take the form of a startup business probably. So you're going to look to take on another order of magnitude, larger investment, hire a lot of staff, and a lot of them are going to kind of serve overhead functions rather than doing the engineering on what you want to do. This is another years to decades time frame that's involved, in an order of magnitude higher amount of money, perhaps millions to tens of millions of dollars. And then you're going to go to market, seek regulatory approval. You're going to have to do some form of clinical trials, put together and submit thousands of pages of clinical documentation of various things, including clinical trials. Go back and forth over another period of years to decades, and this is going to take another order of magnitude more money, tens of millions to hundreds of millions of dollars. And all of this, it kind of requires the support and or the permission of many parties that don't really have a direct stake in the outcome. People, and the most obvious version of that is that all of this money has to be made back with a multiple attached to it. So that really, really restricts what is in the scope of what can happen in this kind of system. So this, that's just the general context. So I'm going to look at a curious phenomenon in the world with diabetes and insulin. I tried to make a very rough order of magnitude estimate of the death toll due to lack of access to insulin. So it was just a very crude methodology that I used. I just kind of counted number of people out there and how many didn't have access, and the consequences of that for type 1 versus type 2. And I arrived at a figure of 12 million per year, so a million a month. And that is about the same as all of the deaths due to World War II while it was going on, the fighting, the famines and refugee situations and everything. So that was the deadliest conflict in history. So for one family of diseases, one drug, that's already, has this, the failure of the system has this impact. It's comparable, same order of magnitude of the deadliest conflict in history. And unlike that, there's very little attention to ending this. What's going on with the supply of insulin? The cost of manufacture is about $1 to $10 per vial. We estimate that we can do with our methods for about $7 per vial. Meanwhile, the list prices are $300 to $600 per vial. There are 3 manufacturers. They have increased their prices in lockstep together for about 20 years. And what is stopping people from entering the market to meet the needs that are not being met here? Well, there's quite burdensome regulation and many signs of regulatory capture there. Potentially anti-competitive practices by manufacturers. Then they're often being sued for the possibility of such behavior, as you can see here. And we'll look at this in a little more detail later. There are complex networks of exclusive secret business arrangements in the supply chain with, rebates and many negotiated payments among a complex web of parties. And, I think, Eve, you pointed out that, we have a system where bribery is called lobbying. Like in this other part of the system, bribery is called rebates and negotiated payments. So zooming out a little more again, the fundamental economics of the situation are just wrong. So just in case there are any economists in the audience, I'll be careful with my terminology. So palace economy, it's this idea of a significant or dominant portion of the allocation of resources being done through a central government. And we have that very literally in the form of, Medicare being a huge part of most institutions' budgets. And also there are many other factors that lead to that sort of result obtaining indirectly. And the business itself, it's built around a lot of monopoly privileges, such as patents, but not only, and cartelized production with, a small set of approved producers, and it's very difficult to enter and, become one of those blessed parties from the outside. And this is rationalized in terms of false claims. The standard logic that some employ here is that subsidies are needed for innovation because innovation is expensive and R&D is expensive, and all that stuff we looked at before is very expensive, and so needs to be subsidized somehow. And monopolies are supposedly an expedient and economic form of subsidy. However, we know that when all is said and done, those monopoly rents do not mainly go into R&D. They go into primarily marketing, and executive compensation is a significant portion of it for a lot of companies, and things like stock buybacks and stuff. And R&D is pretty far down the list. And the result of this is that we have these kind of fiefdoms that are made up of cartels, and they all have captive customers. And if their needs aren't being met, they're out of luck. And if you want to work in any of the areas that are left unaddressed by this, it is a great risk and expense in trying to engage with that. So in contrast to that, falsified story about the role of monopolies, I have found great value in the work of Jimmy Schmitz, who is at the Minneapolis Fed, and he has a career that has a lot of good research on what effects they really have. So he finds, like the conventional theory does, that they drive up prices, but in addition, they also destroy most of the industry's productivity. So it's no longer able to meet most of the demand that's out there. And so, just in economic terms, this is a very large deadweight loss. And when we're talking about medicine and medical devices and healthcare, this is also lives lost and quality of life lost. Another thing that he finds is that they use political machinery to limit the output of competing products by blocking low-cost substitutes. So that may go a ways to explaining what we're seeing with the previous examples I mentioned. So that is another reason why the total output falls far short of the demand, and it drives the poor out of many markets. So here is a GoFundMe for a mother who is trying to raise money for 1 month of insulin for her child who's just graduated and lost coverage. And that bill really is about $2,400 a month. When I had a little lapse in my insurance coverage, I was handed a bill that was almost in the same amount. And fortunately, I was able to sort that out. But if you can't, you can't. And then it becomes very difficult. So the perverse incentives go to the biggest questions that we face. It really is profoundly sabotaging the social good. The example that I think is one of the most dramatic here is, and it's one that I relate to personally because I have type 1 diabetes and I am working on a gene therapy for it, and I have a good concept on paper, and I'm trying to, get this done, and it's proven very difficult to, get what I think should be the obvious interest in this. But here we have, in an article by Antonio Regalado in the MIT Tech Review, an analyst at Goldman Sachs asked a troubling question about gene therapy. Is curing patients a sustainable business model? So, there's a kind of commonplace observation that, a patient cured is a customer lost, but, here are people saying it out loud in forums that matter. This is a real thing. So, as many of us might agree here in this room, I think open source is a very direct answer to these structural issues. So we share knowledge in the commons, and that means that anyone can draw on it for any legitimate purpose, as long as they respect the rules that keep that commons viable. And we have production options open to us where we can produce in low overhead distributed networks, and we've seen that with people addressing supplies in pandemic situations and other under-resourced scenarios. More or less, we involve the stakeholders directly in the work and its governance, and there's much more potential for that as well, and that's built into Open Insulin's plans as well. And it was as a result of these and other factors, we can innovate much faster and at much lower cost. So to provide a little more context for that idea, the theory of the commons that got Elinor Ostrom 2009 Economics Nobel Prize is very apt here. We can have a commons of technology, and this can still be something that is a basis for quite viable, lucrative businesses. And this is something that has been proven in the open source software world for many decades. The technology itself is not exploited for essentially monopoly value. Rather, the technology is available to be applied by anyone for anything, but the skills and the know-how to apply it can be sold as professional services. And this is the basis of some of the most successful and lucrative businesses out there. Red Hat in particular was the largest software company acquisition to date. When it was acquired, it was around $40 billion, I believe. And this can be done while respecting and promoting the agency of everyone involved and market principles like competition and innovation instead of undermining them. So the fact that this has been happening in certain areas of technology, computer software, and more recently computer hardware, and other areas that are relevant to our work here, this directly led to a milestone in diabetes treatment, which was the development of artificial pancreas systems. So closed loop control of blood glucose that reduce or eliminate the need to constantly be manually checking and adjusting the dosing that's going on. So this started off as efforts by just individuals in small groups reverse engineering the communications protocols and working without any resources, really any support. And they beat out all of the manufacturers in making a viable system for doing this. And this was something that they had been talking about for decades. I think the earliest research on this is from the earlier mid 80s. So this happened and got fairly mature about 10 years ago now. And I think it proved not just the viability, but the superiority in many ways of doing things this way. So in Open Insulin, we are looking at developing open source microbes and equipment for protein production and purification, and also the looking to all of this knowledge about how the business models work and develop the complete picture of how this can work in insulin and hopefully other areas where analogous things apply. So in the case of insulin and biologic and other drugs more broadly, there are already many small manufacturers known as CMOs or contract manufacturing organizations. And so whenever there is a reason to manufacture something where it is not being made at the very largest scale for the very largest possible market, such as academic research and clinical trials, it's usually done with the services of one of these organizations. And it's done quite safely, and the product is very high quality. The people who are doing clinical trials don't want to be doing that with a substandard product. So all of the knowledge of how to do that is there. So we're looking at adapting that and just using the same technical basis for production and using some of these business models that are open to us to include direct stakeholder ownership and management of the organization. And as the open source equipment matures, we can also cut the capital costs and build that into the commons as well. So this circumvents potentially the issues that we see with the very complex supply chain that that I mentioned earlier. They are not going to be open to that discussion. I mean, often it's even hard to initiate that, I found. So one example of what happens as a result of this is that, and there are things all through this network that are like this, but for example, a particular insurance company might only cover a particular brand of insulin because they negotiated exclusivity with that manufacturer through a pharmacy benefits manager. And a person who has a job that only offers that insurance, but for some reason cannot use that brand of insulin because perhaps the formulation, they differ a little bit across brands, and that formulation may not agree with one, may make it ineffective or might be allergic to it or something. If that happens to you with your insulin, you get stuck with, going off the formulary and maybe only getting 50% coverage instead of just your standard copay. And so then that goes and it's referenced to these list prices, which are $300 to $600 a vial now. So then you might end up with a bill of $1,000 or $2 a month, whereas normally you would only be paying $35 a month or something. So and there are all kinds of pitfalls like this as a result. So what we're looking at is replacing that supply chain with one that is much simpler and works this way. So we're doing our research in community biolabs, and we're producing open protocols for production. And we actually have a partnership with a nonprofit CMO in the DC area, and we're going to co-develop those protocols and document them and open source them. And then the ongoing work can occur in some combination of cooperatives that have the participation of the users of the insulin themselves, and the smaller scale local CMOs and local pharmacies and hospitals that will be able to handle and oversee the dispensing of the drug. And we can make partnerships with local and state governments to legitimize this and codify how it should work and provide the oversight that needs to come from outside. And we have, in addition to just what's established in CMOs, there's a lot of interest in doing things at an even smaller scale that might further expand the scope of what we can do. And it's coming out of the personalized medicine worlds and the military and disaster preparedness worlds. And in order to organize these fundamentally cooperative organizations that are going to formalize how the users of the insulin participate in the governance, we're also looking at many precedents that may be more or less relevant. So cannabis cooperatives are quite striking in what they've been able to accomplish. They were, state level frameworks that mandated a cooperative structure and were able to permit an activity to be carried out that was perhaps the only thing that is more strictly regulated than what the FDA does. It's, under the DEA, and it's just a Schedule 1 drug. You absolutely off limits. And in the end, it didn't really matter. And so we're also looking at, other historical phenomena of interest like buyers clubs, health insurance co-ops, lodge practice of medicine, and one that's dear to my heart, Discount Drug Mart is an employee-owned cooperative pharmacy chain in Ohio, where I'm from. And I think we have a lot of precedent to draw on here. So I'll quickly show some of the open hardware that we're working on in the project. This is, well, okay, so that in the blank video is a fraction collector that's using the positioning capabilities of a 3D printer, and you have a UV detector for the protein production system, and we're just working on a lot of plumbing, it's pumps and valves and such, and that's kind of how you run it's a macrofluidic system more to produce and purify protein. So this isn't as far along as the microbe research, but it is in the pipe. Another thing we're working on is a bioreactor design that's using common off-the-shelf parts, and this is something that could cost from maybe like $30,000 to $50,000 used in some cases to hundreds of thousands of dollars new. And we have a modular system here where you could add capacity in like 1 or 5 gallon increments, and each unit of that might come to maybe $150, $200 in terms of materials. Some of the parts were left off because we already had them laying around. So putting all this together, the costs can be reduced by orders of magnitude here. And this is entirely in keeping with what the FDA itself knows and advocates. They found that when you get to, and this is not even looking at the improvements we're making in terms of capital costs and such. This is just having more manufacturers. And when you get to 9 manufacturers, your eyes do not deceive you. That line is 0, so that is a negligible cost. And again, this is something that is part of official policy to advocate this, but things aren't coming together yet without a little help. Okay, so very quickly, I'm going to look at some of the history. So why are there all these contradictions and baffling failures here? So I am going to try to present some things that are suggestive that this corporate state finance business nexus that we're accustomed to was established in the form that it exists for the purpose of wealth extraction in an era of colonialism, and we don't like them for those reasons, and also they're not going to last for those reasons because there's nothing left to colonize and exploit. There's nowhere in the world left to conquer. The populations in the home countries are poor and immiserated, and that's it. So it's open source now, and so that's, I don't have time to fully defend that, so I'm just offering some readings to motivate and inform more rigorous engagement with these issues. Gabriel Kolko, we're going to go backwards in time. So he tells a story of how in the wake of the Civil War and the conquest of the West of America, this created large industrial, financial, and commercial interests that were symbiotic with the government, which is a fairly new thing in America. And then they consolidated into a formal economic regime in the following decades. And regulations are one of the regulatory regime, and philosophy that we have is one of the products of that. And so the way that was done, the specific way that it was done, had a lot to do with preempting state and local regulations and doing it in a way that catalyzed the formation of cartels. A lot of homework there for you. And a reaction to that sort of thing, Black Panther's survival programs. So they had a whole range of mutual aid services that were filling in the gaps that were left by, very broadly speaking, this kind of development. So medical clinics, sickle cell anemia research foundation, free dental, free optometry, free ambulances, free food, free breakfast, food co-ops, news service, community employment, shoes, clothing, legal aid and educational program, busing to prisons, etc. Let's go back in time a little bit. So let's go to the dawn of the early modern era. Vernacular Values by Ivan Illich. He was a renegade clergyman and ran a school in Mexico, and he made good use of the Vatican archives, dug up all of how the Castilian Spain and the church collaborated to engineer social institutions to create dependence. And they used this within Spain, they used this to colonize the Americas and extract wealth from them. And on the heels of this, the corporate forms were created to finance expeditions to do this sort of thing. And we got the companies. No coincidence that both a paramilitary expedition and a business organization are called companies and have officers and so on. And they went and did what they were going to do. A lot of this came home in the phenomenon known as the imperial boomerang. It drove people to leave Europe and to go to North America, which we just talked about. Part of what happened in this context was the Salt March. So this was part of a broader philosophy of economic self-sufficiency. The British had a salt monopoly, very heavily taxed. People realized you could just go and get salt water out of the ocean, dry it in the sun, you're done. Everyone who did so was savagely beaten, and nonetheless, that was even worse in the end for the future of the British Empire in India. Go all the way back to the Roman Empire. David Graeber in his book, Debt, the First 5,000 Years, covers a lot of this. Also, I saw this truck parked outside during lunch. Delivery truck, Roman Empire Logistics LLC. So it's still with us. So the Roman army, they would go out and they would conquer, inaugurate a new province. They wouldn't just kind of conquer it and leave. They would stay around and they would impose a military regime, and they would impose taxes that had to be paid. And that would let the soldiers that were staying around and occupying be supported by the people there. and it would remake the whole society in such a way that they could extract wealth and deliver it back to Rome. David Graeber also observes in this example and others that the best definition of slavery at the individual level and subjugation at the societal level that he can come up with is the condition of being cut off from social relationships from which one derives mutual aid. So, concluding thoughts in the form of quotes. William Blake, a prophet of sorts from the imperial era of Britain. War is energy enslaved. We've seen a lot of this in various forms, and this is one that cuts in many different directions here in what I'm talking about. Alan Kay, a beloved figure in computer science. A change in perspective is worth 80 IQ points. Tim O'Reilly, a beloved figure in open source. Create more value than you capture. Okay, and then these are the extra credit slides that are all very interesting that you can read on your own when you download the slides, which you can do with this QR code here. And thank you very much. Thank you for your time.